Welcome to the Fort Myers Beach Good Neighbor Podcast Health and Wellness Series, brought to you by ReNew Yu Natural Health and Beauty, where we make wellness feel possible and turn everyday choices into stronger living. Each episode brings you uplifting conversations, local resources, and practical tips to help you look better, feel stronger, be emotionally balanced, and more connected to the community around you. So take a breath and settle in, because feeling better starts right where you are.
Welcome, good neighbors, to our health and wellness series. Today we're talking about a part of the body that does a ton of work but almost gets zero conversation, the pelvic floor. If you dealt with leaking, or when you laugh or sneeze, or urgency that has you mapping bathrooms like you're trying to find a treasure, constipation, pressure, pelvic pain, this episode is for you. Pelvic floor issues are common, but they're not something you have to shrug off as just aging or just having kids. Today I'm joined by Dr. Greet, a specialist in pelvic floor rehab, and we're cutting through the awkwardness to get right to actually what's helpful and what's not, so you can start doing that today. Thank you for joining us, Dr. Greet.
Thank you so much, Jim.
Yeah, so for somebody who's thinking, pelvic floor, is it just Kegels? It's not, but what is the pelvic floor and what job does it do?
Well, these are two different questions and good questions. So pelvic floor, what does it do? It really supports our organs that are laying on top of it. For example, our intestines, our uterus, our bladder. So it helps to support, actually, that's the first function, to support our organs, inside. And then the second question is Kegels, and I treated thousands of patients in my career over 43 years. And every time when they would come in and see me, they would say, I did Kegels and it's not working. So the reason for that set was Kegels work if you do it in the right way. And that's why the patients would come to me, because I would teach them to do the Kegels in the right way. What is the right way? So what I would do is explain what the pelvic floor is. I would show them how many muscles we have there. And then depending on the testing, how weak or how strong, or sometimes they are in spasm, I would give them a personalized exercise program, Kegels, or relaxation if they would have pain situations in times, because if clients would do Kegels, they would say, I do 100 Kegels a day and it's not doing anything. Well, if your muscle is so weak, you cannot do maybe one Kegel. So it really didn't matter that you did 100 Kegels.
Yep.
The principle of the muscles at the level of the pelvic floor is the same principle as any other muscle on our body. So they need to be trained in the right way.
Interesting. So thank you for explaining that. So let's talk about what people normalize that maybe they shouldn't. What are the symptoms? What symptoms, I guess, are common but not normal if people think, oh, it's just aging, it was childbirth, blame it on something else?
So yeah, most of the time, what we see in pelvic floor is when they cough and sneeze, they have like a little urine coming out, and we call that stress incontinence. And then you have another category that I would say, they go to the store, they're driving home, and once they click the garage door to open, it's like they have to rush to the bathroom, and that's urgency. Or they come home, put the key in the door to open the door, and it's then that urgency sets up immediately. So those are two different categories that we treat, but a lot of people have a combination of both, and so stress and urgency. So that's, so it can be stress separate, it can be urgency separate, but a lot of people have actually a combination of both.
Very good. So let's break this into big buckets so people can actually, kind of understand and make a comment to what they're actually living with. So bucket number one, for example, the bladder. Let's start with the urinary symptoms, what's behind the leaking, the urgency, waking up multiple times a night like so many people do.
Mm-hmm. Well, what is really like when you talk about urgency, it's an overactive bladder. It can have different causes, and that's what we try to explain then. Urgency, what I do when they come in, they fill out like a daily journal. So they put in, for example, how many times they go to the bathroom that day and night, like on a 24 or 48 hour span. And then I can see, or they're getting up at night, how many times they're going to the bathroom. So, for example, I had patients that go to the bathroom 20, 30 times a day and every hour during the night. So that is not a normal pattern. So the treatment itself is like we have to find out what the cause is of the overactive bladder that is giving them that urgency. And it can be different reasons. It can be what you're drinking, what they're eating, the pattern that we see if somebody goes more than 20 times to the bathroom, they know every bathroom in town or on their trip where they're going. So they keep on going every time when they feel that urgency. And now the bladder that is actually normally a normal size of bladder is also going to adjust to the situation, and the bladder becomes smaller. So it's that vicious circle that it's like the more we go to the bladder is never full. They go with the first urgency, so the bladder will adjust. So that is typical urgency. Now, getting up at night, depending for urgency, how much they also drink and what they drink or what they eat, spicy food, they have to get up. But it can also be a different reason getting up at night. They might have some swelling and they will get up because now they lay down horizontal. So the fluid will get better absorbed, and so it goes more to their kidneys, and then they have to go to the bathroom because of that. So it might not be a typical urgency. It might be because they have swelling in their legs or swelling in their ankles. So that could be another reason of getting up. So what we need to do with any patient that comes in for pelvic floor issues in general is I have to just listen what they tell me, what their symptoms are. And a lot of patients think what they have is kind of normal because they are told by their physician when they say, I'm going so much to the bathroom, the physician will say, that's normal part of aging. Just deal with it. Put, a pad in your underwear. And so it makes me it upsets me when I hear that, because I always, if somebody tells me that, I said, well, maybe, your physician should wear a diaper for a day and not be able to go to the bathroom. And that's, compares a little bit the feeling what you have. And it's so wrong to say that there is nothing we can do about these issues, what's actually quite easy to heal. Urgency can also come from constipation. If everything is impacted there and it's pushing to your bladder will be irritated. And so there is different causes that can create urge incontinency. And so the first time I really spend a lot of time talking about their history, what they're doing, what they're eating. And most of the time they are not drinking enough when they have a pelvic floor issue. They drink less and less. And so again, now the urine is very concentrated and can create urgency again. So it's complex, but it's pretty easy to treat.
So speaking along that, you talked about constipation and the straining effect it has on the pelvic floor. What's the biggest mistake people make trying to fix that situation?
Well, they start, go to over-the-counter products and they try to take that and nothing is helping. Constipation, can have different causes also. It can be, number one, sometimes because the pelvic floor is too tight. The pelvic floor can be in spasm, so they cannot relax to have that bowel movement. And then, the stuff is sitting in your bowels forever, and now your body becomes toxic. So I have people that come in and they say, I didn't go to the bathroom or had a bowel movement for more than a week.
Wow.
So that is a serious issue. So most of the time, it's when they have, constipation, they don't drink enough. Sometimes you have to create actually a habit when to go to the bathroom. And most of the time we work on pelvic floor relaxation when that is the issue, because you have to relax your pelvic floor to be able to get a stool out. So, but that is a big issue, for pelvic pain, urgency, intercourse, and so on. So it's a complex thing, but again, easy to treat.
So now we get to the part that bucket number 3 that confuses a lot of people: the pain and tension, pelvic pain, hip, back pain, pain with sex. How can dysfunction be too tight instead of too weak?
Well, it can be most of the time when I see there is actually too tight of a pelvic floor, they might have a bad experience, maybe with their first intercourse. So it was painful. Now the muscles are reacting or trying to protect that area. Otherwise, as I say, it can be compact stool that's sitting there. So it kind of makes it, it's painful because there is just a lot sitting there. And related to the back, all these muscles are connected. So they can have back pain and pelvic floor pain because of, tightness of the pelvic floor. So, but most of the time, I saw a lot of athletes, for example, they pull in their pelvic floor when they lift, so they know that they have to do that, but they created a spasm in the pelvic floor. The muscles are now always too tight. And when the muscle is always too tight and they need to work at a certain time, they're not going to work because they're so tired already. So there is a big, in any muscle, you need to be able to contract very well, and you need to be able to relax very well. And when that is in balance or synergy, that's when you don't have an issue. Now, stress incontinency, most of the time we see that with people that are younger. And in Europe, if somebody's pregnant, we do already pelvic floor rehab before they would deliver a child as a precaution or prevention. And then we continue treating them afterwards because, of course, the pelvic floor is stretched out. So we want to get it back in the normal form. But what we see with stress incontinency is you have the pelvic floor and on top of it, the bladder. And actually, when the pelvic floor is weak, it's just gonna, like a hammock, it's gonna hang a little bit more down. So the support is gone. And then when they sneeze and cough, the bladder is gonna bounce around and there is no support at that point. So what we wanna do is treat the muscles, get them shorter again, so that hammock tightens up again and supports actually that bladder so that the bladder cannot bounce around and you have a little gush coming out when you sneeze and cough.
Interesting. So, which takes us to the question everybody asks, and we touched on it previously a little bit. Kegels, good versus bad. Are Kegels always the answer? When do they help? When can they make things worse?
Well, Kegels are very helpful. I never use the word Kegels. I call actually the exercises we give, you can call them Kegels. I don't call it Kegels. It's a workout for your pelvic floor, like you work out any other muscles in the gym. That pelvic floor needs to be worked out too. So you have better blood circulation, more nutrition, more oxygen, better tissue. So that will avoid any problem. If people want to call it Kegels, that's fine. Kegels then are good, but they have to be done in the right way. And if your muscles are very weak, in the beginning, we will do the Kegels just more like a gentle contraction of the pelvic floor to create more awareness. Some people cannot even do one Kegel. They don't know what a Kegel is, what a contraction is. They have no awareness. So we need to connect the muscle brain again to really feel, and we use a lot of biofeedback with that they can see on the screen when they do a contraction, that, you have to build it up slowly. It's like you do weight training. You have to start with low weights and then build up. You're not going to start doing 100 repetitions with a weight either. So why would you do a Kegel so much? You have to really do the testing first, see what the muscle is able to do, and then build up little bit by little bit. And Kegels have also, there is a, different muscle fibers in the pelvic floor as any other muscle. We have quick fibers, we have slow fibers, and then we have fibers that help you with endurance. So all these separate fibers need to be trained in a different way. So Kegels help, yes, only when you do them right.
So let's talk about evidence-based rehab and what that actually looks like. What's the process in a pelvic floor rehab plan that basically from assessment to improvement?
So we like I said, we do a daily journal. They come in, we have the daily journal. We see how many leaks they have, how many pads they wear. Is it a small pad? Is it a thicker pad? How many a day? They have to change it. So that is actually, one thing we start with. Then sometimes we do manual muscle testing. And so testing the muscles, and if they, have a grade 1, 2, 3, or whatever, I grade them for their strength. That will be also one of the the part of the process, what we do. And then once we can actually see with the biofeedback, and there is numbers like microvolt, what is your rest level when you contract, how high you go, and the difference between that number or those numbers will give us a real strength that we can compare as they move on in the therapy. Now, that's one part is biofeedback that we can use, but we also use a lot of ultrasound. We can see literally if we go to the pelvic floor, we can see the muscles moving up and down. So if they're hardly moving, we know that they're very weak, and we can take pictures and, so the ultrasound is also used in that effect as treatment. Also, the ReNew device is used. Remember the ReNew device we use for connections between nerve ends, our pathways to the brain and the pathway back. As we age, that pathway degenerates. So the ReNew can actually regenerate that loop going to the brain, the central system, and the way back, what really is very important for urge incontinence. Also, sometimes there is an imbalance between, the pelvic floor and the bladder. When, for example, we urinate, the bladder needs to contract and the pelvic floor is relaxing or should be relaxed. Then when we are down, normally, automatically, our pelvic floor closes up and the bladder relaxes. That's the synergy between the two. That's all nerve related. If that system is broken, we have to really work on that nerve part.
So we live here in Southwest Florida. We've got pickleball, golf, lawn walks. We've got a lot of heat going on as well too. What's one smart adjustment for active people that that can help stay hydrated for their bladder symptoms?
Well, I think the general thing, what I say is, normally they say drink 8 glasses of water of 8 ounces and so on. I always say, look in the toilet and see that your urine is not totally clear, but like light yellow. So that is a sign of hydration, that you are hydrated well. So it's not, I will not say you have to drink this or that, because depending on how much you sweat and work out, still your urine needs to look clear. If it looks dark, you definitely need to drink more.
Because when it's dark, it's pulling out a lot of the nutrients and stuff inside it, right?
Yeah, and also it can create a really urgency in your bladder, because it's going to irritate the bladder inside if it's dark. Or it can create UTIs, or, it really needs to be a healthy fluid.
Yep.
Light color.
So last thing, how do our listeners take the first step? If someone's embarrassed, unsure where to start, what's the first step, and what message do you have or want them to remember?
And in general, it is, you have to go to a practitioner that has the experience, that has tons of experience to know what they're doing. Because I see many, physical therapy practices coming out, and if you don't have the experience, you really don't know what you're doing. I always say to my patients, I saw it all. You can tell me anything and everything. And just having a good consultation with a good practitioner that knows what they're doing. And I think that's the same in wellness. That's the same in any field of the wellness field, medical field. You have to know that you talk to somebody that knows what they're doing and have a consultation. And if I can listen to them and listen to their issues, and I can help them with my experience, with my knowledge over the years, with my, I always did continuing education. I was teaching women's health in Andrews University in Michigan. I traveled all over the United States to help set up practices. Boca Raton, in Texas, all over, really over the United States, that I would go to teach them how to do it right. And then it's the experience as you go, because different symptoms will come up, and different, everybody you need to treat really personal and see what the cause is. That's the key thing.
Everybody's a little bit different. So speaking of good practitioners, how would listeners go about reaching out to you if they wanted to learn more, had some questions?
Say that again, Jim?
So how would listeners go about reaching out to you if they wanted to learn more or they had some questions?
Well, they can just have a consultation with me. And that's why, again, we make it affordable for everybody, because we do free consultations. And, if they're not a good candidate, because in some cases, if they have severe prolapses and they need surgery, I would refer them to a surgeon. But if it's like, just urgency, stress incontinency, pelvic pain, prostatitis, so, pain around the prostate, I do a lot of that, or I did a lot of that also. They can come male, female, for a free consultation, and then we talk about the history, and then I give them options what to do starting from there at Renew You in Naples, Florida.
Yep, and that information will be in the bio here. So any last words for listeners today?
If you have a physician that says pelvic pain, leaking, urinary incontinency, constipation is part of aging, you need to get rid of that physician and go to another one that is up to date with what we can do these days.
Very good. Well, thank you again, Dr. Greed. It's been a pleasure speaking with you, and we'll see you out there soon, okay?
Okay, thank you, Jim.
Thank you for spending this time with the Fort Myers Beach Good Neighbor podcast, health and wellness series brought to you by Renew You, Natural Health and Beauty. If today's episode helped you, share it with a friend and check the show notes for local resources and next steps you can try this week. Until next time, be gentle with yourself, celebrate the small wins, and remember, better days are built one breath, one choice, and one good neighbor at a time. Also, to nominate your favorite health and wellness expert to be on the show. Go to FMBGoodNeighbor.com, that's FMBGoodNeighbor.com, or call 239-427-4100. Until next time, remember to Cabo Antilia, Wabo, and keep being a good neighbor.